For healthy women, hormone replacement therapy can help with hot flashes and pain during intercourse. It can also help to prevent osteoporosis, but it's important to know the risks.
Hormone replacement therapy, or HRT, is medication that contains female hormones. It can be used to replace the estrogen that your body stops making during menopause. In the years before and during menopause, the levels of female hormones can go up and down. For some women, the symptoms like hot flashes, night sweats, pain during sex, and vaginal dryness are mild, and they go away on their own. But when the symptoms are more severe, some women opt for HRT. Now, HRT is not for everyone. Certain women have a higher risk, and each woman's own risks can vary, depending upon her medical history and lifestyle. You should not use HRT if you have problems with vaginal bleeding, certain cancers, stroke or heart attacks, blood clots, or liver disease. There are different types of HRT. Some have only one hormone, while others have two. Most are pills that you take every day, but there are also skin patches, vaginal creams, gels, and rings.
If you do decide to take HRT, it should be the lowest dose that helps and for the shortest time needed.